In over 12 years of internal medicine, I have sat across from patients who came in for something completely unrelated, a routine checkup, a skin concern, persistent tiredness they had been brushing off for months, and when we ran the blood work, we found their liver enzymes significantly elevated. Their liver had been struggling, sometimes for years, and they had absolutely no idea. Not because they were careless, not because they ignored obvious symptoms, but because the liver does not work the way most people think it does. It does not send you pain signals. When it is in trouble, it does not give you a clear warning. It whispers, and by the time it starts to shout, a great deal of damage has already been done. What I kept seeing again and again was that the signs had been there. They were just showing up in places nobody thought to connect to the liver. Skin that would not stop itching with no rash to explain it. A heaviness in the upper right side of the abdomen that felt like nothing in particular. Fatigue so deep that 8 hours of sleep made no difference. Brain fog that descended without reason. Bloating that got worse after fatty meals. Hormonal changes that seemed to come out of nowhere. Every single one of these patients had been living with one or more of these signs for months, sometimes years, attributing them to stress, to aging, to being busy, to something they ate. And none of them had connected these experiences to the organ sitting quietly in the upper right side of their body, doing over 500 jobs every single day, and running out of capacity to do them. Today I am going to walk you through all 6 of these silent signs clearly, specifically, and with the science behind each one explained in plain language. Because if your liver is struggling right now, the earlier you recognize it, the more you can do about it. And as you will see by the end of this video, the things that support liver recovery are not complicated. They are accessible, affordable, and they work. But first you need to know what to look for. My name is Dr. Sarah Monroe. I spent over 12 years in internal medicine, and my focus now is helping people recognize the early signals their body sends before small problems become serious ones. The liver is one of the organs I find myself talking about most, because it is one of the most misunderstood and most underestimated organs in the human body. Most people think of the liver as the organ that processes alcohol, and yes, it does that. But that is less than 1% of what the liver actually does every moment of every day. The liver performs over 500 distinct biological functions. It filters your entire blood supply, every drop, roughly once per minute, removing toxins, drugs, metabolic waste, bacteria, and hormonal byproducts. It produces bile, which your body needs to digest and absorb fats, soluble vitamins, and fatty acids. It synthesizes the proteins your blood needs to clot when you are injured. It stores glucose as glycogen and releases it to maintain stable blood sugar between meals. It converts thyroid hormone from its inactive form to its active form, which means your energy levels, your weight, and your mood are all directly influenced by how well your liver is functioning. It metabolizes and clears your sex hormones, estrogen, testosterone, progesterone, which means hormonal balance depends on a liver that is doing its job. It produces cholesterol and regulates your lipid profile. It converts ammonia, a toxic byproduct of protein metabolism, into urea, which is then cleared through the kidneys. If it cannot do that efficiently, ammonia builds up in the bloodstream and crosses into the brain. This is not a simple organ performing a simple task. This is the most biochemically complex organ in the human body, doing work that no machine can replicate, and it is working every second of your life. And when it begins to struggle, when it becomes inflamed, congested with fat, or damaged by years of metabolic stress, the effects ripple outward into nearly every system in your body, which is exactly why the signs can appear in places that seem to have nothing to do with your liver at all. Let us go through all 6 of them. The first silent sign is a specific kind of fatigue. Not ordinary tiredness, not the tiredness that comes from a late night or a demanding week. This is a fatigue that sits in your body like a weight that does not lift, regardless of how much you sleep. You wake up after a full night of rest, and within an hour you feel as though you have been awake for 20 hours. Your limbs feel heavy. Your motivation is absent. You push through the day on willpower and caffeine, and wonder why recovery never seems to come. The reason this type of fatigue is a liver sign comes down to 2 mechanisms. The first is that a struggling liver becomes less efficient at converting stored glycogen back into glucose for energy. When that conversion slows, your cells are not getting the steady fuel supply they need, and the result is a kind of cellular exhaustion that no amount of sleep can address directly. The second mechanism involves the liver's role in filtering metabolic waste. When the liver is congested or inflamed, toxins that would normally be cleared efficiently begin to accumulate at low levels in the bloodstream. These circulating waste products affect mitochondrial function, the energy-producing machinery, inside every cell, and the result is fatigue that is cellular and systemic, not simply a product of how many hours you slept. If you have been living with this kind of bone-deep, unexplained tiredness, and you have had your thyroid checked and your iron levels checked, and been told everything is normal, your liver may never have been considered, and it should be. The second silent sign is itchy skin with no rash. This one surprises people the most, and it is one of the most specific early indicators of liver stress that exists. Here's what is happening. Your liver produces bile, which is stored in the gallbladder and released into the small intestine to help digest fats. When the liver is struggling, bile flow can become sluggish or partially obstructed, a condition called cholestasis. When bile cannot flow freely, bile salts begin to accumulate in the bloodstream, and when those bile salts reach the skin, they deposit in the tissue just beneath the surface and trigger nerve endings there, causing an itch with no visible source. No redness. No hives. No rash of any kind. Just a persistent, maddening itch, often worse at night, often affecting the palms of the hands and the soles of the feet. Most people who experience this spend months trying antihistamines, changing laundry detergents, moisturizing more aggressively, and wondering if they have developed an allergy. The connection to the liver almost never occurs to them, and it is rarely the first thing a doctor investigates either. But unexplained itching, particularly on the palms and feet and particularly worse at night, is a recognized clinical sign of biliary dysfunction. If this describes something you have been living with, it deserves investigation. The third silent sign is a dull discomfort in the upper right abdomen. Not sharp pain, not the kind of pain that sends you to the emergency room, just a heaviness, a fullness, a mild ache that sits just below your right rib cage and tends to be worse after large meals, particularly fatty ones. Many people describe it as feeling like something is sitting there that should not be, or like their right side feels fuller than their left. Here is the important piece of biology behind this. The liver itself has no pain receptors inside its tissue. You cannot feel the liver directly, which is part of why liver disease progresses silently for so long. What you can feel is the Glisson's capsule, the fibrous outer lining that surrounds the liver. When the liver becomes enlarged due to fat accumulation, inflammation, or congestion, this capsule stretches, and the capsule does have nerve endings. The stretching of that capsule creates the dull, pressure-like sensation that people describe in the upper right abdomen. It is not dramatic. It is not alarming on its own, but it is real, and it is the liver's capsule telling you that the organ inside it has expanded beyond its normal size. The fourth silent sign is brain fog that arises for no clear reason, difficulty concentrating, a sense of mental slowness, thoughts that feel like they are traveling through something thick, forgetting words in the middle of sentences, a cognitive heaviness that was not there a few years ago, and that you have started to normalize as simply getting older. The mechanism here connects back to one of the liver's most critical functions, converting ammonia to urea. Ammonia is produced constantly as a byproduct of protein metabolism. In a healthy liver, it is rapidly converted to urea and cleared, but in a liver that is struggling, ammonia clearance slows. Ammonia levels in the blood rise, not to the levels seen in advanced liver failure, but to subtly elevated levels that are enough to cross the blood-brain barrier and interfere with normal neurotransmitter function. This produces cognitive effects in advanced liver disease. This becomes a condition called hepatic encephalopathy, but low grade. So clinical ammonia accumulation can produce milder versions of the same cognitive symptoms: the fog, the slowness, the difficulty finding words, that affect people with early or moderate liver stress long before any formal diagnosis is made. This is one of the most underappreciated connections in medicine, and it is one that changes how people understand their own cognitive experience when they learn about it. The fifth silent sign is persistent bloating and nausea, particularly after eating fatty or rich foods, not the occasional post-meal bloating that everyone experiences. A consistent, predictable pattern where certain meals reliably leave you feeling heavy, uncomfortable, and slightly nauseous for 1 to 3 hours afterward, and where this has been getting gradually worse rather than better over time. The connection to the liver comes through bile production. Every time you eat a meal containing fat, your gallbladder releases bile, produced by the liver, into the small intestine to emulsify that fat so it can be absorbed. When the liver is producing insufficient bile, or when bile quality is reduced due to liver congestion or fat accumulation, fat digestion becomes incomplete. Undigested fat passes further into the intestine, where gut bacteria ferment it, producing gas, causing bloating, and creating the nausea and discomfort that many people attribute to food intolerance, irritable bowel syndrome, or simply a sensitive stomach. Many people in this situation eliminate food after food from their diet, searching for the trigger, and never find a consistent answer because the issue is not a specific food. It is the liver's reduced ability to produce the bile needed to process fat efficiently. If fatty meals, creamy foods, or large restaurant portions consistently make you feel unwell in this specific way, your liver deserves to be part of the conversation. The sixth and final silent sign is one that affects both men and women, but in different ways. and it is the one that people least expect to connect to their liver. It is unexplained hormonal changes. In women, irregular menstrual cycles that were previously regular, worsening PMS symptoms, sudden increases in estrogen-related symptoms like breast tenderness or water retention, or unexplained weight gain concentrated around the hips and abdomen. In men, reduced libido, the development of breast tissue in an area where there was none before, unexplained mood changes, fatigue linked to low testosterone. The connection is direct and it is significant. The liver is the primary organ responsible for metabolizing and clearing used hormones from the bloodstream. Estrogen, in particular, is processed and deactivated by the liver before being cleared through bile and urine. When the liver is congested or functioning below capacity, this clearance slows. Used estrogen recirculates in the bloodstream rather than being eliminated. Estrogen levels effectively rise, not because the body is producing more, but because the liver is not clearing what has already been used. The result is what is called estrogen dominance, and its symptoms in both men and women are exactly what I just described. This is why hormonal imbalances that do not respond to hormonal treatments, that seem to appear without obvious cause, and that coincide with the other signs I have mentioned today, should prompt a look at liver function before anything else. Now, here is what I want you to take away from all of this, because I know that hearing 6 signs of a struggling liver can feel alarming, if you recognize yourself in some of them. So let me be clear about 2 things. The first is that experiencing 1 or even 2 of these signs does not mean your liver is seriously diseased. Many people have 1 or 2 of these experiences due to other causes: stress, dietary habits, sleep disruption, hormonal fluctuations. What these signs should do is prompt you to pay attention and to ask your doctor for a liver function test, which is a simple, inexpensive blood panel that measures your ALT, AST, alkaline phosphatase, and bilirubin. These numbers tell you whether your liver cells are under stress, whether bile flow is impaired, and whether intervention is needed. It is one of the most informative tests available, and it is almost never requested routinely, unless a patient asks for it or a specific symptom prompts it. The second thing I want to be clear about is this. The liver is one of the most regenerative organs in the human body. It is one of the only organs capable of significant functional recovery. When the conditions causing damage are removed and it is given appropriate support, people who have been told their liver enzymes are elevated, who have been diagnosed with non-alcoholic fatty liver disease, who have early signs of liver stress, these people have a genuine window of opportunity to reverse the trajectory. That window does not stay open indefinitely, but it is real, and it is wide for most people who act on it early. The 3 most evidence-supported things you can do starting today to support your liver are these. Reduce your intake of ultra-processed foods, added sugars, and refined carbohydrates, because excess fructose from processed foods is one of the primary drivers of fat accumulation in liver cells, independent of alcohol intake entirely. Add genuine movement to your daily routine. Even 30 minutes of brisk walking daily has been shown in published research to significantly reduce liver fat over 8 to 12 weeks. And add specific liver-supportive foods to your diet. Cruciferous vegetables like broccoli, Brussels sprouts, and cauliflower contain compounds called glucosinolates that activate liver detoxification pathways. Bitter foods like rocket dandelion greens and artichokes stimulate bile production and flow. And coffee, yes, actual coffee, has now been supported in multiple large studies as genuinely hepatoprotective, meaning it actively reduces the risk of liver fibrosis and cirrhosis. 2 cups per day, without excessive sugar added, appears to have a real and measurable protective effect on liver tissue. These are not dramatic interventions. They do not require a detox kit or a supplement protocol. They require consistent daily choices that align with how your liver actually works. And for most people in the early and middle stages of liver stress, these choices make a measurable difference. I want to hear from you in the comments right now. Tell me which of these 6 signs resonated with you. Was it the fatigue, the skin itching, the brain fog, the bloating after meals, the hormonal changes, or that right side discomfort you have never quite been able to explain? Your answer will help me understand what to focus on in the next video, and it might also help someone else reading the comments realize that they are not alone in what they have been experiencing. If this video gave you information that genuinely surprised you, or that you think someone in your life needs to hear, please share it. The liver is one of the most silent and most consequential organs we have. The earlier the signs are recognized, the more that can be done. That is the whole point of this channel, to give you the information your doctor may not have had time to explain, delivered clearly and honestly so you can make better decisions for your health. If you are not yet subscribed, please do that now. There is a great deal more coming on topics exactly like this one. The signals your body sends before serious illness develops, explained in the way you actually need to hear them. I am Drive. Sarah Monroe. Your liver has been working every second of your life without asking for anything in return. It is time to pay attention to what it might be trying to tell you.